Hi, my name is Brittany Hutchinson. I am an RN for Bethel Hospital. I see that my patient COPD has a medical order for a central line dressing change. We do this every 7 days per facility policy, and I've checked her allergies and she doesn't have any, and I looked specifically for any tape or antiseptic allergies, and we're using the chlorhexidine today. No allergies to any of those. I've also prepared my heparin and saline flush in the med room, checked the expiration date, and did the first med check on both of these in the med room. So I'm ready to go into my patient's room. I'm gonna wash my hands. Hi COPD, it's Brittany, your nurse. Can I come in?
Yep.
All right, how are you doing today?
I'm doing good.
Good. I see that you just got a central line placed. How's that feeling?
It's okay.
Yeah, does it hurt at all?
No.
Okay, that's good. I'm just gonna scan your wristband. Can you tell me your name and date of birth?
COPD 2/12/47.
Okay, great. And do you have any allergies?
Nope.
How about, do you get any like skin reactions to tape or like cleaning supplies?
Nope.
Okay, perfect. So that matches the chart. I'm also going to scan in these meds here, and I'm going to complete my second and third checks with the MAR. So those are all set to go. Have you had a central line dressing change before?
I have not.
Okay, so we do these. We change like that tape and stuff around there every 7 days, and this is to prevent infection. And you are at a high risk for infection because that central line opening is very close to the access of your heart. And so just a couple things that we do to promote just sterility around there is we do change the dressing very frequently, and when we do, we make it a sterile procedure, which means we're just kind of extra careful about not contaminating the field at all. So because of that reason, I'm going to ask you to wear this mask, and then I'm going to wear one as well. Just put this over your, we'll just turn your head to the side as well. We don't want to breathe or cough over the field at all. And I'm going to raise the bed up. Do you have any questions for me before we get started?
Nope.
Okay, perfect. Just going to raise this up. It's a little bit easier for me to work. Okay, and for the sake of the video, I'm not going to wear the mask. Alright, so, and I am going to remove the pillow from behind your head, and this helps to just open up that chest cavity. So, here you are. Are you comfortable?
Yep.
Okay, perfect. So I'm just making sure all these clamps are closed before I get started, and it looks like they are. Grab some gloves here. Oops. And I'm going to set up my sterile field. And I have my work triangle here with the trash below me. And now I'm going to remove the old dressing now. So I'm just gonna do this distal to proximal. Just let me know if that hurts at all. Try to be gentle. And I'm just gonna grab a gauze pad here. Make sure I don't break the sterility of that. I'm just gonna anchor that down. And remove the old one. Remove my gloves. I'm gonna wash my hands again. And I'm ready to put on my sterile gloves now. Right before I do that, we are gonna be changing a cap here. So I'm just gonna prepare this here. And the first thing that I'm going to do is clean it with this chlorhexidine swab. I'm going to press on these and I will activate the chlorhexidine to come out, but for the sake of the video, we're just not going to do that. And so I'm just going to secure the catheter, make sure I don't move it at all. And I'm going to scrub for at least 30 seconds, but just for the time of the video, I'm not going to do the full 30 seconds. And I'm going to let that air dry, and I'm not going to fan it or cool it off or anything there. And then I'm going to place this new blue patch and then apply the Tegaderm. Just gonna do it centrally there. Just making sure I get all the air bubbles out. Going all around it there. Oops. How does that feel?
That's good.
Okay, good. Just making sure I'm not causing any discomfort there. Okay. I'm going to label that with the date, time, and the initials. Put that label there. And then I'm going to measure the lumen that we are going to be changing, which is this white one here. So I'm going to measure from the catheter to the end, and I see that it is 18 centimeters. And I'm going to note that change, or not the change, but I'll note the length in my chart there. So I'm going to prime this here. Perfect. We are going to be giving 5 milliliters of this. Oops. And then without touching the tip of that, I'm going to take it off. All right. I'm going to aspirate and check for blood return to ensure that this is going in the right place. And we do have blood return, and if I didn't observe any blood return, I would notify the provider right away, because this could indicate that it is not in the place that it was originally intended for. So I'm just going to administer this 5 milliliters over 1 minute, but for the sake of the time of the video, I'm just going to push it in. Oh, I have to take the clamp off. And push it in. All right. Now I have the heparin here. Just gonna make sure I prime that. Okay. And again, just administering this over 1 minute as well. 5 milliliters is what the chart had intended for. So I'm going to administer that. Of course, for the sake of the time of the video, I'm just going to give it at a normal rate. All right. And then I'm just going to clamp all of these. Make sure that I secure this down. Perfect. And then how does that feel?
That's good.
After the flush, it feels okay too?
Yep.
Okay, perfect. So I'll put that pillow under your neck again. There we go. All right, so I'm just gonna document the dressing change, and then I'm going to document the length of the lumen. I'm going to document the site that it was intact and no signs of infection. And I'm going to wash my hands as well.